would like to welcome each and every person that is on the call tonight for our fourth session of RISE. RISE is actually a race, inequity, solidarity, and empathy conversation that we have been having for our community so that we can be able to be more eventful and intentional as we go into anything that we're doing as it pertains to individuals of color or individuals of non-color. And what we want to do in this particular showcase is to have that opportunity to be able to speak to each and every person that we can. And on tonight, we're going to be talking about healthcare. And we have some great panelists lined up ready to go ahead and get us segued in. Just like to point out, we want to definitely give a great shout out to our sponsors for the event. We have Elizabethtown Community and Technical College, Western Kentucky University, and Limestone Bank, of what all of three to make sure that this event could be possible. And then we have, of course, you all. So we'll have question and answer in the middle after our moderator, Jerisa Lamons, goes through a couple of questions. Please feel free to go ahead and start submitting those through the chat so that you'll be able to get it lined up. And for those questions we're not able to answer, we will also have an opportunity to answer those in the Facebook page. You can go ahead and call out your, pick up your friends, by letting them know, hey, we're getting ready to get started. Check in, let the community know that you're doing something positive to go ahead and find better ways that we all can collaborate together and work together. Last but not least, we want to put out the rules of engagement for tonight. We want each other to be heard. This is not an opportunity to do anything other than, figure out ways that we can break down the barriers and the walls. So in order for us to hear each other, we got to listen to one another. Then also be patient, be a little bit more intentional about using I statements opposed to a collective conversation about we. We want, again, this to be effectual and we want it to be purposeful. So without further ado, I'm going to take some time to also give a shout out to our RISE t-shirt maker that we had on board with us. We have Totally You Tees. We want to definitely thank Stephanie Bankhead, and t-shirts are still on sale. And we would definitely love if you all would patron Totally You Tees, and they're being so gracious. Part of the proceeds of the shirts from RISE will be donated to the ethnic minority scholarship that's at Elizabethtown Community and Technical College. So you're already getting an opportunity to zone in. Without further ado, we're going to go ahead and pass it over to our moderator of the evening. We have Mrs. Jerisa Lamont, who is the Director of Cultural Diversity at Elizabethtown Community and Technical College. Ms. Jerisa, are you ready?
Good evening, ladies and gentlemen. I'm excited to introduce our panelists who are able to be here with us tonight. First and foremost, I want to thank each of you for your time and your dedication to your community. So I'd like to give the audience a little bit of introduction as to who we have here today. First, I'll start with Ms. Terry Bergen. Ms. Terry Bergen serves as a health promotion manager at Lincoln Trail District Health Department. However, in the midst of COVID-19, her role is primarily that of public information officer. Terry has over 24 years of public health experience. She's earned her Master of Public Health from Virginia Commonwealth University and a Bachelor of Science in Nursing from Wingate University in North Carolina. When asked to do RISE, she felt it was important to participate because over the years, conversations and progress towards addressing health inequities, disparities have stalled. However, there is something different happening right now. The unrest in our country has defined this as a human issue. It has required us to look beyond color. I want to be a part of the conversations that are beginning within my own community that lead to real change, and RISE allows me to do that. Thank you for being with us tonight, Ms. Bergen. I'd also like to present Mr. Terrace. I know him by Troy Horton, and his bio begins with, he was born and raised in Hardin County. He attended G.C. Burkhead Central Hardin Middle School, West Hardin High School, and was a member of the original Bruin class of 1991 at Central Hardin High School. For his post-secondary education, he attended Tri-City Barber School and then moved on to Northern Kentucky University, where he ended up receiving his degree in TV and radio broadcast communication. For the greater part of his life, he said he would consider himself to be a functional alcoholic. However, I have been sober and alcohol-free for 2 years now, And my 31 mission in life is to be an example to my community, showing that no matter what you can do, you can overcome addiction. I love Hardin County, and he said he's beyond honored to be a part of this panel. I'd also like to mention that Troy Horton was the founder of Horton's Barbershop, which some of us locals may remember was, to me, a staple in the Black community in Radcliffe. So thank you for being with us tonight as well. Did I miss anyone, Danielle? I wasn't sure. I see a phone number here, but I want to be sure I represent the right person.
Yes, Dr. Mulder, we are trying to get her on now.
Okay.
And so go ahead and introduce her, and we are I am working the technology.
Sure. So without further ado, I'd also like to introduce another one of our panelists as Dr. Chandra Mulder. Dr. Mulder earned her doctoral degree, PhD in educational psychology from the University of Kentucky. She spent 5 years as an assistant professor, completing her 5th year in the Master of Special Education program within the School of Education at Kentucky State University, the only historically Black college and university in Kentucky. Her research interest includes teachers' perceptions about their capabilities in teaching racially and culturally diverse students, multicultural education, and equity issues in public schools and higher education institutions. Dr. Mulder holds a Kentucky certification in school psychology, where she spent 8 years working in the public schools, advocating for a quality education for students with various disabilities. She is versed in special education policy and law, trauma-informed therapy, and crisis counseling. She also completed an advanced program required for the Director of Special Education Certification. Dr. Mulder is a licensed psychologist with the goal of working with children and adolescents. So please help us welcome Dr. Mulder as well. So now that we've had a short bio from each of the panelists, we're going to go directly into the questions, because as we were discussing today, this hour moves very fastly and we want to be able to give everybody time to respond. So I will begin with the first question, and that is, can you describe the kinds of racial health disparity each of you see in the area you represent? And that can also include gender. I will allow, Dr. Mulder, if you'd like to kind of weigh in on that first, and then we'll defer to Terry, and then Terrace, you can also weigh in on that as well.
In terms of mental health, we know that there's not a lot of mental health professionals that are racially diverse. So that's one of the concerns, because many people want that. The second thing is that not a lot of mental health professionals take insurance or Medicaid, which is another barrier for people, because the rate could run between $130 to $200 an hour for a psychologist. So those are, and then of course we know about the historical stigma of even connecting and wanting to see a mental health professional. So that's, those who are ready to see will be hit with finding someone to take their insurance.
Right. Thank you. Ms. Bergen? You might unmute yourself.
Thank you for having me. I will be looking down every now and then at my notes, so if you see down, that's why. So within public health, some of the things that are standing out for us is the infant mortality within our counties among people of color. When you look at the number of mothers of color who are having babies and those babies who are dying, there's about 15 babies that die per 1,000 births. Compared to the white population, it's 6. So we're looking at half. So our babies are dying at a higher rate. One of the other things that we also see is related to preterm births. A lot of our women of color are having babies before 37 weeks gestation. 15% of the births occur in that regard, 10% among the white population. The teen birth rate is also very high among Asians, Hawaiians, Pacific Islanders, Hispanics. For every 96 births out of 1,000, among people of color, it's only 72 out of 1,000 births for white. Now, I can't not talk a little bit about COVID-19 and everything that's going on with it right now. So when we look at our COVID-19 cases, our population in Hardin County is about 12% when we talk about people of color, but our people represent 20% of all the COVID-19 cases. And when you look at deaths related to COVID-19, we account for 30% of all deaths within our counties related to COVID-19. So this, it is nothing that we have not heard before. We know that among people of color, the health disparities have always been there. I am just glad that we now have an opportunity to maybe push it a little bit forward and take some steps to kind of correct some of this.
Thank you. That was interesting data, Terry. Thank you for sharing that. I hope that hits home. I mean, the data cannot lie. Troy?
And you're speaking on the mental health aspect of in the Black community.
Troy, what I'd like for you to really speak on is your experience as being in recovery. Like from a patient's view, what are you seeing that you feel are the disparities that you may have experienced as a Black male struggling with addiction who's now in recovery?
Well, I mean, it's pretty much across the board. It's like the stigma of Black men having to be a lot stronger, and if you go to someone for help, you're looked down upon and looked less than, and it's hard enough just to beat the alcohol or the drugs as it is, but then whenever you go to try to find some help and there's no one who looks like you, it's either a Black female or a white male or a white female that's trying to, counsel you. There's no way that they can have empathy on what you're going through. So, that's the disparities that I see as a Black male in any community. I mean, Hardin County, Kenton County is and when the guys, people do beat recovery, it's hard for people to come out and be a helper. Like me stepping out is to help other people who can say, hey, you can do it as well. But it's hard I don't know too many people that I can kind of reach on or lean on, especially in the professional field, if that makes sense.
Very interesting. See, that's why I'm glad that you're on this panel, because people really need to hear that perspective. So thank you for that. I'd also just, sharing a personal experience. Terry, you mentioned preterm birth was something that our population deals with. And I want people to also know that it's not a socioeconomic thing. I myself had my twins at 29 weeks. And so I know that there are a lot of things that they don't talk to you about. There are a lot of things such as postpartum depression that are also not discussed with our population as well. So I'm very glad that you had the data to point that out.
Yes, and you're right. And I'm so glad you mentioned that, because that accounts for socioeconomic, it didn't have impact, and education level as well.
Right. And I think a good point to bring that up is because, to me, what that says is that money doesn't really erase any implicit bias that somebody might have. It still is just going off the physical appearance of your skin color being Black or brown. So I think that's a very important point to bring up. So for my next question, and this is a mental health question, in terms of mental health access, what does it mean to have culturally appropriate counseling? That's been mentioned a bit tonight. And what are the barriers or opportunities for this in Kentucky? I would definitely like to start with Dr. Mulder. I'm sorry if I pronounced it wrong again, but I'd definitely like to start and hear your perspective on that question.
Okay, thank you. If you think of culture beyond the color of your skin, it's just kind of, your preferences, your values. Can't really explain it right now, but I will say what it means for a person to be culturally responsive would be someone who uses that information to work with you, is first aware of that information, learns that information, and uses it in their therapy. For example, say time. Time in the African American culture and the value of time maybe in the majority culture might be different. So if if I'm working with someone and we have an hour, I may not be abrupt when our hour is over because they may still be talking. And so I might say, we have 15 minutes left or we're over time, but finish your thought. But if you're strict about time, that comes across as being rude and that what I'm saying is not valued because you gotta, get through this particular hour. So that's just one of the things. I think the assumption is that if you have a therapist who looks like you believe that they are aware of your culture, they understand some things that you're saying. Another example in dealing with children, if you say, I spank my children, which is something that might be common in the African American community, you're not looked at as someone that might need to, you might need to call Child Protective Service on, for example. So you just want to be aware that what you're saying that might be common in the African American culture is not misused in mental health profession. You're not overdiagnosing people. You're not over, policing people. Just taking that cultural that might be different than you, because we'll find that a lot of mental health professionals are white females that maybe come from a middle class background and may not be aware of the level of stress it might be to live in poverty, but it doesn't necessarily mean it needs to be pathologized and you need a diagnosis based on that information, if that makes sense.
It makes very good sense. I think that awareness of someone's culture allows the patient to be more open with their therapy, which is only going to lead to better help. And those are very good points. Terry, I know that you don't delve a bunch in mental health, but if you'd like to speak on this, or I'd love to hear from Troy as well.
I can go. The mental health aspect, and my perspective is a lot of men, especially Black men, going to talk to a psychiatrist or someone in mental health. I mean, it's just unheard of. Our fathers didn't do it. If our fathers were in our lives, and if we were raised fatherless, that's even worse. You're going to see us shrink. I mean, just from playing the dozens, from all the things, and as you're growing up. I mean, so I would encourage we start like at a younger age, encouraging mental health. But, if it starts in the public school system or something like that, instead of sending a child to in-school suspension or something like that, we have them speak with a mental health specialist at a very young age to make them comfortable with that, to get them used to expressing your problems. Because that's one thing I've learned in my sobriety is, you got to get that stuff out, because as an alcoholic, I was drinking to suppress the things that I had inside and the things that I was unwilling to face. But then as soon as I started to get sober and my brain started to, I had to rethink and relearn everything. And the ability to talk to someone, and especially to talk to someone who was, who looked like me, it made things a little bit easier, but I can only imagine if it was some, like a white female who probably has all the empathy in the world, but could never relate, especially culturally, so the mental health aspect from a man's perspective is a little bit different from maybe having a woman's perspective.
So I'm so pleased that you're a part of that panel, because that's a great perspective and something that's not thought about a lot. Ms. Bergen, do you want to weigh in on this, or I can move ahead?
Well, I don't have much to say on this particular topic, other than just to kind of echo what everyone else has said. A lot of times, within communities of color, you're stigmatized if you go seek care, mental health care. It's just not something that the Black community normally would do, historically anyway. And I think some of that is still lingering and among our communities. And doing what Troy mentioned, I think, steps us in the right direction.
Right. Thank you. And Terry, one point I would like for you to speak on, if you're able to, is I feel like that those same cultural feelings also weigh in on lack of preventative care as well. And then maybe if we find out that we've got a chronic condition, I think that some of those cultural norms also come into not, receiving preventative care as far as general health goes. How do you feel about that statement?
Well, I think there's a lot of things. Chronic disease does not happen in isolation. There are other things that influence that. And a lot of research is coming out now about social determinants of health. So where people live and they work and they play have an impact. So if you live in a community where you are living in poverty, where you don't have sidewalks, where you don't have transportation, you're not going to be able to get to a provider. It makes it that more difficult to access care, to get to the things that you need. One of the things, this kind of speaks to question two, what we know is that people of color are least likely to have medical insurance. They're least likely to be underinsured, less likely to see a medical provider due to cost, more likely to incur substantial medical debt, and least likely to have a primary care provider. And when you drill that down, our local data is showing us that for those that have a medical provider, many cannot even get off work to go see a provider because they can't afford to. They need to feed their families. They need to pay their rent, and it makes that much more difficult. Or they don't know how to access the benefits that they have or how to use those. You throw transportation in there, how are you going to get to where you need to go if you don't have transportation? All of that meshes with preventative care, access, and chronic disease, the ability to appropriately care, make sure that you are receiving the appropriate care for chronic disease. I hope that answers your question.
Oh my honey, that covers it very, very gracefully. Yes, it does. I'm going to move on and delve a little bit more into addiction, because I really think that addiction is people in recovery are something that we kind of try to stay away from. They have a large stigma. So I really want to delve into that. Troy, of course, I'd like for you to respond to this. In terms of addiction in Kentucky and Hardin County, what do we know about access to services for people of color?
Well, I'll speak because I love Hardin County, but I'm actually in Kenton County now, and I'll speak from the Commonwealth of Kentucky's point of view. And I'll be real with everybody on here. The difference between access to recovery, because in the 80s and the 90s, whenever the crack epidemic hit, they were locking people up. And then when the white community started doing meth and all that kind of stuff and bringing the heroin and stuff like that, they would bring them back to life with the Narcan. Instead of locking them up, they put them through rehabilitation training. So that it's systemic, and it's a very systemic thing. And when we have to realize that, and then hold the people who develop these programs accountable and say, hey, we understand that in the 80s and the 90s, we were locked away for crack cocaine, for a little piece of crack cocaine. But you guys are Narcanning and bringing the communities back to life, which they should, but it's affecting our communities in two different ways. So it's systemic. So, and then whenever the stigma of going to something like that, to go into a recovery treatment, it's just like in the Black community, going to the doctor is a big deal growing up. Like in our community, it's different because we have military around us and the Hart Memorial Hospital and everything is kind of close. But in other situations, like especially in the 70s and the 80s, the grandparents and the parents don't go to the doctor because they're going to put that TB on you or that syphilis on you, or it's studies have showed that. So we have to break stigmas, and we have to break stigmas, and then also hold the people who control these treatment centers accountable for true diversity and inclusion, not diversity and inclusion that holds a board of all white men thinking that they're doing something really good by offering these services. We need to hold them accountable for having someone who can come into these services, relate to the people who are going through recovery, because you got to meet people on their level. And if you're coming in with an authoritative suit and tie, uptight, bow-breeding, that's just going to make someone want to go use again. So it's like it's two folds of the answer. It's systemic as far as like with the crack epidemic and how Black people were treated that way. and then how the heroin epidemic happened and how they treat the non-Black people and how in recovery. So that's where the breakdown is, and that's where I think we should address.
All right, thank you. That was good information. Really. So I see that we're getting a little close to time.
We are
Okay.
still very good on time, and I'm taking down questions as they come into the box. So if you want to have
Wonderful.
Dr. Mulder talk a little bit in terms of that same question, we have lots of time.
Please, I'd love to hear her thoughts.
I would say, as a trauma person, we know that people that have gone through childhood trauma, if you're familiar with the ACE study, which is adverse childhood experiences, we know that that's related to later outcomes like substance abuse. And so we need people that are compassionate, because I know that everybody that comes to my office may not be ready, that I may not see them for a while because it's heavy stuff that they've never dealt with before. But when they come back, I don't have to say anything. We just pick up because I understand, I have compassion that this is difficult work. And so as a mental health professional or someone who deals with people in vulnerable positions, it's a privilege to work with people and to hear their story and take that story and be compassionate and have empathy, but also ensure that they are working on the changes that they have come to work on, as opposed to what I want them to work on, right? And so my goal is that we all, display healthy behavior. But what I find in the African American community, many people haven't seen a healthy person. They don't recognize what that looks like. A lot of times they don't even recognize that they've gone through trauma because it's so prevalent, and they see, if I say to you, you didn't have a father, that may play a role in your relationship. Someone might say, like, that's not a big deal, right? It is like bulb go off when we make connections to the work with the action, that someone is sharing their story, maybe for the first time. And if we're compassionate, we take that trauma in perspective. And I heard a drug therapist or a psychiatrist say this: the reason why people do drugs is because it works. It helps you forget what you're trying to forget. So, you just really have to work with people where they are and understand that we all could be in that position. So I'm not necessarily better than anyone that come in my office. I've just been privileged and blessed to overcome some of the trauma that I've gone through. But sometimes, and when we talk about culturally diverse, sometimes as African-American people, we want to hear that story from our therapists.
Yes. Explain why that, please explain why that's important, please. I really need you to break that down, why that vulnerability is so important.
Well, I would tell you, when you're going to a predominantly white university, learning, therapy and psychology from those perspectives, there's a big thing about ethical things, and we're told not to really connect with the person, not to show emotions, really just be, if you want to talk about the stereotype of a cold person sitting there while you're bearing your soul, and they're just going, like nobody would want to do that, right? And so they need to see you as a person who happens to know a little bit more, but they understand and they know where you're coming from. They've gone through trauma. You don't overshare. There's a thin line, for ethical reasons. But that's the first thing we want to do, is build rapport and break down those sort of, I'm the instructor, you're the student perspective. And it, it could be as simple as the way you set up your room. If you have a chair way over here, or you're way over here, you're tapping on the computer, all of those things, that environment, it has to be compassionate, and you have to be present in the room and really understand that what people are saying, they may be saying for the first time, and they may have just felt that for the first time.
Oh, wow. There were so many good points in that. Like, I don't even know what to refer back to, but what I will take is a little personal spin on that, doctor. And when I was in school for social work, I felt like that at times that they were teaching us to be that cold robotic therapist. And I at times felt like that couldn't be me. I have to heal people by connecting with people. So I am so pleased to know that there are other social worker, therapists, mental health professionals that are out there that feel that that is important. To me, that is a part of culturally responsive therapy there, is connecting with your patient. So thank you for those. So for my last question, what I'd like to discuss is some equity and on a national and state level. So, and this will be kind of my closeout as to, based on your area of experience, what is one thing that needs to be done, whether it be nationally or at the state level, in order to move us towards more equity in healthcare? I will open up and would like for Terry to respond first to that, and then Troy, and then Dr. Mudler, if you'd like to respond as well.
I'm going to go back to those social determinants of health that I mentioned earlier about the growing volume of research that we're seeing. We know for a fact, research is suggesting that medical care only accounts for about 10 to 20% of health outcomes. The rest of that, the other 80 to 90%,
My phone over there.
To demographic, environmental, and social economic factors. It's tempting to think that the impact of those social determinants of health, like food insecurity, transportation, financial literacy, for example, is concentrated within at-risk populations, but we're also finding that, such as Medicaid recipients, this affects all populations. So 68%, one study showed that 68% of patients had at least one social determinant of health challenge. And this was based on a randomized study of about 500 patients. And then there was a Kaiser Permanente study that found 68% of adults had at least one unmet social need. So our focus really needs to be on population health, because it will provide an opportunity, which provides an opportunity for healthcare system agencies and organizations to work together in order to improve the health outcomes in their communities. That's kind of what we do here at Public Health. That's one of our major goals, is improving the health of populations. And one of the most powerful tools that we have to mitigate these types of circumstances is policy. So if we can address health inequities through policy change, it will have more of a systemic effect. It wouldn't be a Band-Aid. We wouldn't just be giving people stuff just to give people stuff. You know, there is some good things that come out of policy change. So comprehensive policies can assist in correcting structural and system deficits that benefits all populations. You know, it benefits us all when we all do well, not just certain populations. When we all do well, we all benefit. So policies that provide affordable health care for everybody, that works with work preparation, so getting people ready for work and increasing employment and making educational opportunities available for everyone. That benefits us all, and policies that address that is what I think we need to do on a national level.
Yes, ma'am. I can completely agree with that. Policy is where it's at. That is where change happens. I think I had called on Troy to go next, so I'll let you weigh in there.
On the national level, I agree with what Terry said. I think that we need to have healthcare across the board for everybody, and we need to change stigmas. And policy, but I think if we change stigmas and start at a community level and really fund these programs, not just get them by. I'm talking about athlete pay fund these social workers and people who work in social and mental and health. Just like she said, a community where everybody's more healthy and learns how to eat to take care of themselves, learn the importance of having strong relationship and relationship building with people, even as elementary, and breaking it down and how to have a relationship with a partner, whether it be your boyfriend or girlfriend or your husband or wife or your wife or your husband or your husband, you know, having good relationships and building that kind of stuff and putting money into that instead of, and I'm saying reallocate funds. You know, we hear a lot of take away a defund. Oh, let's reallocate the funds to people who can agree on a diverse and a inclusive and diverse place instead of white men on top trickling down the money to keep us divided. Let's break all that up. Let's people get some truly diverse and inclusion. And because we all think the same thing, we want better for ourselves. So let's instead of the athletes getting millions and millions of dollars, let's let's put that into social services and building it into our communities. And I think that would just that would be a easy fix.
Yeah, and I think that could get done by policy as well, Troy. And those are the things that I think are important for us to embed in policy. Is that I never understood why teachers, social workers, and mental health professionals get paid on such a low level when we do so much work and we go home with so much. It's very hard to be in those positions and take people's trauma and things home with you and still have your own life to live. So yes, I agree with all those points and the policy as well. Dr. Mulder?
I'll just talk about a couple things that I'm aware of in terms of legislation. There was a policy or a legislation put forth by a Democrat to do a racial disparity study before a legislation go forth to see how it impacts people of color. That legislation did get passed, but hopefully it'll come up again. And my work at the cabinet now, I have a secretary of the Cabinet for Health and Family Services, who has chosen to take up anti-racist organization. So we're working at a leadership level trying to see how we at the cabinet, who are dealing with people in our child protective service to child care and nursing homes, long-term care, the services that the cabinet provide, how can we not re-traumatize people who are coming to us for support? And then the last thing, I'm on the board of the Kentucky Psychological Association, which is the association for the state of licensed psychologists. Two things that we're doing is we're trying to ensure that we provide several trainings at our convention, because it's one of the places that most of us get our training, that's on racism and racial trauma and things like that. But on my own, I am trying to put forth the legislation to make it required that mental health professionals get culturally responsive training like we do and for suicide and domestic violence. These are things that we have to do to keep our license. I want that to be culturally responsive training as well. Now, I'm getting a lot of pushback on that, but that's okay. We're gonna hopefully get this legislation passed on the books again. It was on the book the last time. It didn't get heard. It didn't get passed. But I'm going to continue with that because sometimes we have to, like you said, policy and legislation to make it important to some people.
Thank you. As a moderator, I really try to control my face, but I just can't sometimes. So excuse me if I'm raising my eyebrows and my eyes light up with surprise on some of these things, but this has been some great conversation. So something else I'd probably like to discuss is, and we've touched on it just a bit, but I really think it's important that we talk about in the healthcare profession. I think it's important that we also give some action items. How can we develop our young people to want to go into these professions so that we can see and mirror, what it would feel like to have 1,000 Jerisas in mental health? What are some things that you feel like that we could be doing to push equity and just the interest in medical programs and mental health practitioner programs? I will start with Terry and then go to Dr. Mulder, and then Troy, I saw you shaking your head, so I know you want to weigh in, so we'll go with that.
I really think from a foundational perspective, one of the things that we see in public health is a lot of generational, the same mistakes made generation to generation to generation. And it sometimes is very hard to be pulled up out of that. And so you have to start and change that mentality early on in order to switch that thinking. One of the ways to do that is one of the ways that Troy mentioned is within the school system. The more we can expose our younger individuals to more and more opportunities, I think it changes paths. I really do. And so their eyes are open to different things that will plant a seed that will maybe lead them in a different direction. Mentors also are very good at preparing those who may not have a father or who lack really good mentors, that they do not have a father, can also guide and push people in the right direction. Community, getting behind people of color and also playing a part, I think, are different ways in which we can potentially push our folks more into the healthcare or mental health arenas.
And I want to ask this, and this may be very dangerous to ask, but it's a local community conversation. But do the panelists maybe think that there are things that local hospitals could be doing to encourage our young Black and Brown students to enter into programs like that? Could there be more exposure in the school systems coming from our local hospitals and practitioners here in our local community?
I'm going to talk on that in just a minute. I think, I believe that, I think that everything that's happening in the United States right now is really eye-opening for a lot of people because things have been considered normal for so long. This is just how things are, and we really have not addressed it as we should have. And so I think more diversity is needed regardless. More representation of our people in those programs are needed. And I think we're moving in the right direction to get there, but the work is not done yet. And I hate saying that because I want to get to a point where we no longer have to say there's still more work to be done. There's still more work to be done. That is my hope that we'll get there. But I do believe that now that the conversation has started, we may see more and more of those programs develop.
I'm glad to hear that. And I know I jumped from situation to situation, but there's just so much I want to cover in so little time. So I will regress back to the last question for you, Dr. Mulder. And that question was, what is that one thing that you feel like that we should be doing nationally to address equity in healthcare?
Equity in healthcare. In terms of mental health care,
Sure.
I think we're exposed to it a little bit more now because they have more counselors in schools. But we have to take care of some other things that are causing people to require mental health, right? She said those social determinants, right? When you start taking care of communities, the housing, schools,
Yes.
the achievement gap is going to be a future issue of getting into programs because we're still heavily dependent on standardized assessments to get into programs. So if we don't take care of the achievement gap, then that's going to cause future issues from the graduation rate. All of those things that children are going through, it's going to be very, very difficult to change the future. But I think that people need to see people.
I'll go back to it again. I think we should break it down to the elementary school level to where we get involved at such a young age and teaching the kids at a very young age, basic things like waking up on time, getting to places early, and creating positive, like Dr. Mulder said, is creating role models for people to see. And if we start it at a very young age, it'll be the normal for the children. It'll be, instead of if we start them off at 5, 6 years old, teaching them how to get up on time, it's okay to express your feelings, not suppress those feelings. And you said recruiting them into the mental health and the public or health care part, we reward them. It's not that hard. A dollar goes a very long way to an elementary school kid. And you can break it down and, okay, you completed this task, here's 5 cents. Here's 5 cents, and create that, and then show them how to take that 5 cents and build wealth off of that, and how to work that and work credit and teach all those things at an elementary level. So when they come up, I mean, because I'm not saying that we give up on our generation now or the generation that's in post or like middle school and high school, but if we take the attention that's on the United States of America right now, and we say, okay, we learn from what we've been through, and we focus that attention on the next generation, we will not experience any of the things that we can heal this thing, instead of, I'll go back to white supremacy and the white man on top sprinkling down what they think that our babies need. We need to take control of what our babies get.
I agree. I completely agree. All right, I have Tanya. I think it looks like we're probably about time for Q&A. Yes. Am I correct? Okay.
Yes, we have this first question here. Get your questions into the Q&A. I have this first one here. How would someone from Hardin County who is not familiar with African American culture learn? In other words, how can people of non-color learn to empathize and do this work? Great question. So how do we be a better ally, right? How do we learn? Where do we do that, and so we can be better advocates?
Listen, I'll just say that. I was like, when you do get that opportunity, when you get comfortable enough and someone you are privileged enough and to get on a relationship level where we feel comfortable talking to you on that real level, when we like conversations like this and we're not sugarcoating things up and we're talking on that real level, listen, when we say, hey, we're tired of white men telling us how to be, and then you look at the numbers and you look at the boards and white man on the board, and we say we want diversity and inclusion, you listen and we make changes toward that way. And then if we're coming at you abrasively, it's not because we're trying to be harsh, but this is just how we communicate with each other. This is how we effectively communicate. So my suggestion is, don't expect us to dumb our communications down. Have empathy and listen. That's pretty fair.
Okay, Terry.
I agree with Troy, but that listening should bear fruit. So once you have listened, let's go with that and start moving our communities in a direction that will make a change. So that may look like talking to people in leadership roles within the community, bringing your community leaders together and having them have one voice, then talking to those individuals who are in power and vote the people in that can help make those changes for our communities.
Great. Dr. Mulder, would you like to address that question?
Educate yourself so much out there on the internet, and I will start there, and then we need to go out of your way. You may even have to be uncomfortable, but go out of your way to, when I hear empathize with African American people, I hear, let me see them as human. Let me see them as myself. And I think that happens when you are around people and you realize that we're similar, we're the same.
Here's another question here. If people were interested in reading more about health disparities and where we are in terms of mental health and inequities, what do you guys recommend as those go-to resources for people that are wanting to learn more in this area? So what would be one of your recommendations?
I was listening to a broadcast recently that had some really those people that thought thinkers. What do you call those folks? You know what I'm trying to say. People who are just, well, anyway. And Kamira Jones was on there, and I'm not sure if you guys know her, but she is fantastic on anything related to health equity and health disparities. And one of the documents, so anything of her work is fantastic. One of the documents that they mentioned was unequal treatment. And from what I understand, this was back in 2003. So it's not a current document, but it's still relevant. And what it looks at is it looks at how healthcare inequities occur and how health providers bring their own stereotypes and prejudice and things into the conversation. Many of them were surprised that they had these, you know, which kind of brings me back to one of the things that I was going to answer for the other question. A lot of times we're not aware of our own pre-existing prejudices and biases that we bring into a conversation, not just healthcare workers, but we ourselves from our own experiences. So I think it's just a good document to read because it kind of helped shape some things.
Okay, so Troy, what about you? What would you recommend people to read?
I'm more of a audio, people learn differently, and as far as like audio books and things like that, I mean, I would start off with like Message to a Black Man. I listen to, I mean, reading. I don't know if I can answer this question because it doesn't pertain to health. I would just think the big book from the AA. If that's gonna be talking from a recovery standpoint. If somebody wants to read, I would suggest reading the big book from AA.
No, I completely agree. For something last year, I started reading it for something I was teaching on, and it's in order to understand recovery and community, one of the things that you have to understand is what are the materials that folks are using in recovery if you want to empathize and understand what people are saying there. And it's one of those things that you really, if you want to be involved in recovery, you have to know the foundation. So I completely agree. So the next question we have, and this is, this is one that we can think about as a community. So there are not many opportunities available in Hardin County where diverse races actually connect. And you know, what could be some of the opportunities that we can organize locally to meet and listen beyond, you know, what we're doing now is the basic education piece, right? And this question is spot on. Once we can meet together, because I don't want to say we need to with our public health expert on here with us, you know, that's not a very good thing at this point. But once we can, you know, we really do need to be thinking about those ideas of where we meet together that can facilitate more small group face-to-face conversations to move us into actual action in our community together, right? In order to put some of the ideas that have been thrown out at all of these sessions together. You know, as the individual who submitted the question pointed out, there's something to be said for that face-to-face interaction that we miss, even though it's great being able to do the Zooms right now. Once we can get back together, making sure that we take that further. And to the audience member that submitted that, yes, we are talking about that as far as the organizations that have put on RISE. So we are thinking about it.
Can I say, like whenever we were going through the riot situation, I want to give Hardin County a big hand clap because you guys handled that amazingly. When you had Mayor Gregory and the police and the fire and everybody down there together, it made my heart so proud to see our community come together. And if you guys can do it for that just answers the question. If you can do it for that moment in time, you can do that any time that you want to. And you come together on a common goal. If we're saying, hey, the whole world is saying that there is a disparity and racial inequality, and Hardin County is not as bad as other places. But if we can be an example and come together as a community and show other people, just like what we did whenever the riots were happening, and it didn't even touch Hardin County. It was like there was a force field around us, and we came together in unity. And I think that has a lot to do with Hardin County as a place. But I think we just build on that. To answer that question, I think if you just build on what you guys are already doing. So proud to say I'm from Hardin County.
Well, thank you. Dr. Mulder, are there things that you want to add on to this last part of it? What do we need to be, what is it as a community? What have you worked on in your own community? Dr. Mulder is from Lexington. So what ideas would you share with Hardin County based on the work you've done in Lexington? So I believe you said reaching out to our NAACP, which we've got Tanya Seabrooks on here that is part of the leadership of that group. She did our dinner last year. And so what was the next one?
I know you're close to the military, right?
Mm-hmm.
You're going to see a lot of diversity there. I'm a veteran, so I'm familiar with the services that the veterans are offered and programs that are there. You have a wonderful university there. So you have some diversity there and some programming there that maybe need to come out to the community a little bit more. Other than that, I can't really think of anything, but, if you feel like this need to go out in an op-ed in the paper, some type of churches are a great place. I remember taking a culturally diverse class, and we were, the students were told they had to go out and go to a diverse place, and they all went to churches. So if you want to go to, they say that most segregated part of our week is church. So, you could go to churches. They're very welcoming, not just Sunday morning, but maybe some programs that
Mm-hmm. I think Dr. Mulder is absolutely right. And I think there are some real ideas that as far as the organizers of the RISE sessions that we have been thinking about, when this initial period ends in 3 weeks, what are going to be our next steps? Because we don't want to leave this as it was just an education series for 7 weeks. That is not the intent of anyone who's gotten involved with the RISE series. So we will be reaching out with some more ways to get input from those of you who have attended our sessions to think more about these questions. So if you're not, we are absolutely thinking about these things and trying to come up with a really good next steps that includes a lot more people that other folks can take ownership and leadership of the work. So Tanya, do you want to close us out?
Sure. Just want to definitely give a hand to all of our panelists tonight. You all were absolutely amazing. I thank you for all the information that you shared. I thank you for the transparency, the honesty. That's where we're trying to go in, because we want this, again, we're intentional about what our next steps will be. And if we have the right data and we have the right information, we can definitely make some changes. And I pray that everybody that was participants on the call tonight had an opportunity to just dig in and find out more about, from mental health to other areas of healthcare in general. Because one of the things that needs to happen is that we all need to be okay about going to the doctor. We need to feel comfortable about going to the doctor for whatever the need is. So we definitely want to make sure that we took in from everything from the panelists, Mr. Troy, Ms. Terry, and Dr. Chambrea. Thank you so much. We appreciate you taking this time on your off time to share with us some things to help make us better. Hardin County, we're stronger together. I know you hear that all the time, but we know that will definitely happen. Again, we want to make sure we give special shout out to our sponsors, HCEC-TV, WKU, Limestone Bank, and I would be remiss. I mean, I work with some of the greatest ladies here, Dr. Danielle Lovell and Teresa Lamons. We have been having a wonderful time putting together these panels because we wanted the information and we wanted to make sure you had it as well. But this is how we build our community. You may say, hey, we want to do a series on something else some weeks from now. Okay, great. Whatever we need to do, we will get it done. And I also would like to close with big shout out to Totally UT, Stephanie Bankhead in Radcliffe. Our t-shirt business is also, she has designed the RISE shirt. If you're interested in having a shirt for RISE, remember, a proceed from that shirt will go to the equity scholarship at HCEC-TV And we are super excited about that as well. So again, we're getting ready to sign off. Just reminding you, if you have not done so, please fill out that census for 2020. I beg of you, fill out that census. If you want to see the questions before, the sample questions are online. No excuses. Get counted, Hardin County. That's where the money come from. Everybody talked about money needing to go in the right places. Well, when we have no money, we have nothing to talk about. So let's go ahead and get that census filled out. And if you have not registered to vote, get on that too. You got a lot of things to do in your community. If you want to make the community work, you got to get involved in it. Share it with your friends. Look forward to seeing you all next week when we're going to be talking about what, Danielle? That's going to be talking about business next week.
Black-owned business in Hardin County.
Black-owned business.
We're going to get.
Yes, we're going to be
awesome
talking about that next week.
Yeah.
So tell your friends, don't keep this to yourself. We're talking about changing our community. That means you got to open up your mouth. So yeah, let them know, and we'll be right here next Thursday, 7 to 8. You got us. Have a great evening, everyone.